Recording in progress. This is Dr. Jessie with CHIRO for Moms and I guess CHIRO for Kids as well. We have Katelyn Neufeld here today. Katelyn and I go way back, but she is a midwife, and we have yet to interview an amazing midwife here on the course, and we're dealing with midwifery every day. And so this is like a beautiful piece to the course. So what I'm going to do is just have Katelyn introduce herself, a little bit about her practice, and then we're going to dive into a lot of the questions that you guys ask us, and we'll keep it under 10 minutes. But if you have more questions, I highly encourage you to reach out to Katelyn. Her information will be down below, and you know how to reach us here at the clinic. Katelyn, the floor is yours.
Sounds good. Well, I am a certified nurse midwife. I work at Western OBGYN and primarily see women at our clinics in Waconia and in Chaska.
And I guess, could you give us just a background of midwifery in general? Because honestly, a lot of people don't fully understand what it is and the distinction between like obstetrics and maybe working with a doula and, you know, just kind of what it is in general.
Yeah, so midwives go way back. You know, midwifery is just about being with women and caring for women. And so for many, many years, women had midwives with them while they birthed their babies. And OBs are kind of a newer thing that birth has been more medicalized in the last few hundred years. And so now OBs attend a lot of births. There are a variety of types of midwives. So there are midwives that have apprentice training that primarily work in the home setting. They're certified midwives, certified nurse midwives. So midwifery can mean a whole lot of different things. I'm personally a certified nurse midwife. And so my path to midwifery was that I was a labor and delivery nurse first, and then I went to grad school to become a nurse midwife. And so we, you know, kind of practice independently of physicians. We see women for annual exams, well woman care, you know, things like yeast infections, BV, birth control, all those types of things, and then offer prenatal care, attend deliveries, and do postpartum care. And so we, you know, in some ways are similar to seeing an OB, that you would go to a clinic and see your provider for your visit, and then that is who would be with you at your birth. And we collaborate with physicians as needed. So in my clinic, there's 4 of us nurse midwives, and then there are 7 OBGYNs. And so we work with them if someone ends up needing a C-section or has twins or has something other high risk going on where they would benefit from having an OBGYN as part of their care. And so then in those cases, we either collaborate with them and share care, or we transfer mamas to just see the OB if that's what's going to be best for them.
That's amazing. Everything you just said, well, there was a lot in there that people do not know. And I love your background as well. And even that you came from labor and delivery. That's really neat that you made the choice. That's super cool. When you are with your patients and you're dealing with labor and delivery, that particular component, are you there the entire time? Do you encourage women to have a doula as an adjunctive part of their labor and delivery? Or I'm curious as to how you guys do that.
Yeah. You know, it really depends on the labor. I would say one of the biggest difference between having a midwife and having a doctor is how involved your provider is at your birth. And we love to be with women while they're laboring. So we will be one-on-one with women when they're in active labor, being there to support them, help with position changes, help with coping mechanisms, and then be there, you know, for their delivery. We love to work with doulas. So we really strongly encourage our mamas to get a doula as well. Just if the off chance that we have 2 mamas in labor at the same time and have to split our time between them, we know that women really benefit from having one person with them to support them their whole labor, and their partner or their spouse can be that person, but it's often helpful having a doula who's had experience at a lot of labors and might be helpful just kind of supporting you through your labor process and helping your partner be helpful, because this could be their first experience with labor and birth too, which can be overwhelming sometimes. So we do some of both. We love when our mamas have doulas. If they don't have doulas, we will be there and supporting them through the labor process, which I think makes a big difference. And we really like, having our mamas know us, that we know our mamas, and then we get to be there with them through their labor and birth. I think it makes a huge difference having someone there supporting you who you've gotten to know over the course of your pregnancy, and they know you and your preferences and kind of your hopes for labor as well.
Well, I guess that leads me into, what it like the schedule when you're pregnant, when you see an OB, you kind of have a set schedule. Is it similar with midwifery? Or
yeah, it is similar. Our appointment times are kind of 2 to 3 times as long because we really value the education piece and helping you make decisions about your pregnancy. So we'll spend an hour or more with you at your first prenatal visit, just kind of going over your medical history, what your hopes are for your pregnancy, things you might be worried about or have questions about. And then we usually see you at least once a month for the first half of your pregnancy, and then every couple weeks in the second half, and then every week at the end. So similar to seeing an OB, you'll come into the office for a visit. Our visits are just longer, and we really like to use shared decision making, especially in your pregnancy. And so we'll talk about what test options there are, what kind of childbirth education classes or courses might be helpful for you, and help you make informed decisions about what you want for your labor. If you think you're going to want an epidural, or if you're interested in a water birth, if you want a doula, helping you sort through all the options that there are around pregnancy and childbirth.
And when you're dealing with labor and delivery, where you deliver, what is the facility like?
Yeah, it's a birth center in a hospital. So we have 6 labor and delivery rooms that are all kind of huge hospital rooms, and then they all have big tubs in them. So we're the only hospital in the metro that has tubs in every room, which I think is awesome because a lot of our mamas like to use the tub and even deliver in the tub.
Because I know you kind of specified which clinic you're with, but so everybody knows where you're at.
Yeah, we deliver at Ridgeview, the hospital in Waconia.
Okay.
And we have lots of mamas drive from all over, a half an hour, 45 minutes to come there. It's a nice size in that, we have an OR there if there's an emergency, if we need it. We have anesthesiologists there if we need them, or if someone wants an epidural for pain relief. But we do a lot of unmedicated births and a lot of water births, and you're guaranteed to have a room with a tub in it, which is really nice. And it's something that a lot of our mamas like using.
And I did kind of interrupt you when you were talking because I wanted to talk about the hospital, but I kind of want to go back to you being the only space that has a setup like that. Can you just backtrack a moment? That was my fault. Just a little bit about it being so unique that way.
Yeah, it's unique in that it's part of a hospital. And so, like I said, we have this kind of emergency net if we need it. But all the labor rooms are huge. They're, 3 times the size of kind of what you would expect in a hospital room. And then they all have really big bathrooms in them with really big tubs that could easily fit 2 or 3 people in them. So some people like to have their partner in the tub with them, or just want to have room to stretch out or be on their hands and knees, be in different positions, which is really helpful. A lot of the hospitals in the metro have 1 or 2 rooms with tubs, but we have tubs in every room. And I think that's something that draws a lot of people to our hospital, is they want to have the option to labor in the water, because that can be so, so helpful.
That's amazing. I'm going to leave it there because I feel like anything above and beyond is going to be super specific to what women are looking for. But I do encourage anybody watching this, you're watching it because you have questions about midwifery and you're already thinking that this might be something you're interested in. I highly encourage you to ask, because like Katelyn said, this is something that has been going on for a long, long, long time. And it's because it's so incredible to have a midwife by your side going through this with you. So thank you, Katelyn. You're amazing. What you do is amazing. And just thank you for your time. This was wonderful.
Thank you.